Hi, everybody. Welcome back. I'm Jeremiah Dobrik. I'm the breaking news editor at the Long Beach Post. And here at the Post, we've been doing live interviews every weekday with people across Long Beach, either in leadership positions or being affected by the pandemic. And we're just trying to bring different perspectives about what is going on and how everybody's dealing with it. And today, we're really happy to have Chief Robert Luna from Long Beach Police Department. Thanks for joining us, Chief.
Thank you, Jeremiah. Thank you for doing this. It's a great opportunity because of the current environment that we're in, that we get to touch base with as many of our community members, and hopefully there's a lot of good questions that come in.
Yep. And on that topic, if you have a question for the chief, pop it in a comment on Facebook, on Twitter, where we're live, and it'll get fed to us here, and hopefully we'll have some time to answer it. But I have a long list of questions, Chief. We had a lot of people submit questions. I think you are someone in the department, are an institution people are really interested in hearing from right now, just because so much has changed. And the scope of this, how much it's changed every bit of daily life. And I guess to start, can you give me a snapshot just how much life has changed right now working for an officer, a detective on the front line? How different is their day to day?
It's different. It's very different in some senses, and in other senses, maybe not so different. When we recruit and hire police officers, we hire them, and what we try to explain to people is sometimes in this job, what appears to be normal or what you expect to be normal isn't so normal after all. And since we've been involved in this from the beginning of March, for officers to continue to come to work, because if you remember back to the beginning of March, the big talk was how many people could stay home, who can telecommute from home. And for our officers, our police officers, and our civilian employees, they didn't have that option. They were what you call essential employees. So for them, leaving their families, coming to work, really looking at us and looking at each other to figure out how can we make our work environment safe. And when I say safe, we're always concerned about safety, being a police officer. When you go out in that car, you get those calls, you contact people, you never know what's going to come out the other end. But in this sense, with this virus, you almost get the feeling that it could be anywhere. You can touch somebody, be infected, and then what most officers will tell you, most employees of ours will tell you is, I don't want to take this home to my family. And of course, we have nearly 1,400 employees here. Everyone's got a different story. But at the end of the day, to me, they're all heroic, because as other people have been ordered to stay home, our employees are here at work. They're serving the community. Yes, we may have modified some of the things that we're doing, but at the end of the day, if somebody needs help, you're going to get a police officer there from the Long Beach Police Department to help you.
Let me break down some of the nuts and bolts changes you may have made so people know what to expect when they call a police officer now. Is something going to be different when they call 911? Is when they see an officer on the street, is something going to look different? I believe everybody's been issued cloth masks at this point, and they should be wearing those, right?
Yes, the officers have been issued face coverings, and they've also been issued masks. From the very beginning of this event or this incident when it occurred, we issued basically personal protective equipment to every police officer out in the field. And I'm sure those will be questions that'll come up later, but more directly to your question, when you call 911 for either police or fire, the operators on the other end will ask you a series of almost like screening questions to find out if maybe anybody on the other end of the line may be infected. That's very important for our first responders to know, so they know how to better prepare for the call. And that's the thing we've always told our community is, when you call 911 or the 7-digit line, try and give them as much information as you can, because that downgrades the level of anxiety and fear that you may have going in. And in this situation, say hypothetically somebody is infected, we're still going to respond, but we may have to don our protective personal equipment and utilize that differently. You will see our officers out in the field, if they cannot practice that physical distancing, will be wearing a face cover, or at times even a mask. Don't let that, I'm sorry, go ahead.
I was going to say, I know one of the calls you've gotten more, this is a whole new type of call, is social distancing calls. And one of the questions we've gotten a lot from readers is how the stay-at-home orders are being enforced. And to the point, have you guys had to cite or arrest anybody at this point? And at what point would you start citing and arresting people?
So we are, as a police department, enforcing the current health order. Although to date, we've only written one citation.
What was that for?
To a business.
Oh, okay. Do you know what kind of business it was?
It was a smoke shop up in North Long Beach. And but I've got to emphasize, before we really started going out and taking enforcement action, I think, actually, let me remove that. I know that no one in this police department was trying to underestimate, one, the unprecedented situation that we're in. And if you think about that, and maybe that word gets overutilized, it's the unprecedented restrictions on our freedoms. And our officers are human, so they get it. They're not always in uniform at work. When they're off, they're no different than anybody else. So everybody understands it impacts everybody. I preface that because when we go out and we either get complaints that a non-essential business is still open, our officers working with our city partners, we're going out and educating and advising a whole lot.
So it seems like that worked well until you had this one particular case. They just basically flouted the orders even after you explained you have to close. Is that essentially why you had to cite this one shop?
They were cited after multiple warnings to close, and they basically ignored the city.
Sorry, go ahead.
Real quick, Jeremiah.
Yeah.
I think it's extraordinary that even though we talk about the one citation, I want to point out that I'm so proud of our community in general, our business community, because we are getting compliance. Yes, there is a small number of people who may divert from that, but I did not expect this level of compliance. I knew we would do good as a city. I didn't realize we would do this good. And that is very, very helpful, because then the officers can focus on other things. That being said, we are still getting dispatches. It looks like we're averaging about anywhere between 10 and a dozen in the last several days per 24-hour period of social distancing. And in all those cases, the officers are going out. A lot of them aren't necessarily social distancing calls. Somebody calls because they think somebody was violating the health order. The officers end up going out there and finding that either A, it's not the case, or they have a good communication session with with whoever the members are, and there's a good understanding, and both of them walk away. But one other thing I want to add about enforcement, it's a misdemeanor, and it could be up to a $1,000 fine. That's not lost on any of us. We can talk about this pandemic and the health issues surrounding this, but we understand that there's an economic time bomb that appears to maybe go off. And we're very cognizant of that and very sensitive to that. But at the end of the day, we expect compliance.
You're doing my transitions for me, because my next question was going to be about, there is a small group of people who in Long Beach specifically have talked about protesting the health orders because they want to go back to work, because they're experiencing that economic pain. Now, there's been no protests so far that I'm aware of in Long Beach. There's been some in Huntington Beach and Newport Beach and nearby. But there is a small group planning to organize one. And I didn't know if that's something, what would the police department do in that situation? That's something you would put a stop to?
We get protests all the time here. I think you've covered many of them. I'm very confident in the experience level that the members of this police department have in handling any and all protest. And directly to your question, people have the First Amendment right to protest. You may not like or agree with what somebody's protesting, because especially in the last year or so, we've had to deal with counter protesters. You have people on one side of the issue, you get the other side, and that's where the conflict comes in. So our job as a police department is to facilitate any lawful protest that's going on. We want people to express their First Amendment rights.
Wouldn't the protests run afoul of the health orders as they are right now, though?
I mean, every scenario is different. From what we're monitoring around the country, it looks like some of the protests that we've observed, we're in constant contact with other police departments around the country to learn from successes and failures. And there are departments that are choosing to take a step back and allow the protest, and at the end of the day, to make sure it's a peaceful event. For us here in Long Beach, again, learning from other departments, if people come out and want to exercise their First Amendment rights, we're obviously going to do everything we can to make sure that they're safe, that the people coming out to observe are safe, and we'll facilitate whatever we can. Yeah, we're going to monitor the health order, but at one time, our incident commanders out there will evaluate between the law, what's being violated, and what's the good for everybody that's out there. What's the good for everyone involved, so nobody gets hurt and there's no property damage. But even though I sound like I'm facilitating a whole lot, I want to make it clear that if people come out to protest, they're expected to be lawful. They're expected to not behave poorly. That means commit violent acts or damage property. We will not tolerate that. And that's where it crosses the line for us.
This sounds a lot like the balance lots of law enforcement agencies are trying to strike right now in another area, which is prisoners and inmates, where they're weighing who to release to try to stop there from being possible outbreak behind bars, and who to keep locked up in the interest of keeping the community safe. I know LA County said recently they've released up to 25% of inmates in their jails from people who were almost done with their sentence to people who were lower level crimes. We've had misdemeanor bail be reduced to zero. We've had some felony bail also be reduced to zero to try to empty out some of the jails and prisons. And I'm wondering what have you guys run your own small city jail? Have you guys started releasing more people, and have you adjusted who you're taking into custody?
Excellent questions. And yes to a lot of those. And let me try and break that down. So one of the modifications that we made, along with many other modifications for officers in the street, is to use even more discretion when they were considering taking somebody into custody. So if there was a chance that you can either cite somebody or let them go, that is something that we are looking for. We were trying to, at the end of the day, reduce the population that we had in our jail. And it looks like from the stats that I have that our arrests are down during this last month about 10%. So some of that is working. And what we're doing is our command staff here is reviewing a sheet that shows us all the arrests. And we're looking at the arrest, and the majority of those are felonies. We have, whether it's parole violations, domestic violence, gun charges. I mean, there's some significant arrests that are being made. And if at any time we see an arrest that we think could have been evaluated a little bit different, we'll just make contact through the chain of command and say, hey, what happened here? And 99% of the time, the officer had a complete legitimate reason for taking that person into custody. But along with that, if somebody gets taken into custody, we have a nurse here, and they screen each of the prisoners that are coming in. And remember, for all of our viewers here, is that when somebody gets taken into our custody, they're in our care. We care for them like they're part of the family. And so we're going to make sure they're okay. We're going to make sure they're fed. So once they get up in the jail, if they pass through the booking sergeant, if he doesn't choose to release them at that point or cite them out, the jail's being cleaned about 5 hours per day. And that's a lot more than it used to be cleaned. So it's being cleaned, recleaned. People are being shifted. The population is a little bit lower. But if we have any indication that somebody may be infected, we immediately will get them transported to LA County Jail. And so far, so good. We haven't had any situations where an employee or a prisoner has been impacted in a negative way due to this virus.
And now, but I just want to clarify one thing you said. But the reason they're transported to LA County Jail, is that because LA County Jail is just better equipped to quarantine or isolate a prisoner?
Yes, okay. That's correct. Yeah, they are. Obviously, it's a much bigger system. They have actual medical care they have access to. So when I say LA County Jail, that could mean USC Medical Center, the jail ward up there. So that's part of the entire system there.
With a few different things happening, with fewer arrests, with more releases from jail, but also with these stay-at-home orders, what's happening to crime? Is it going up? Is it going down? What are the trends you're seeing?
So if you don't mind, I definitely want to talk about crime, but there was a very good question you asked me right before that I didn't get, because it's all connected, and I'll see if I can connect all the dots for everybody. So yes, bail was reduced to 1 penny. March 17th, if you committed what people consider to be a nonviolent crime, there was a whole list of crimes now that were only a penny. And we were kind of in shock when that happened, although we understood why the decision was being made. For reasons that we obviously want to manage crime, that was very concerning to us. So if you take the 1 cent bail, many individuals that our officers have arrested, for example, commercial burglary, auto theft, auto burglary, all those crimes are considered nonviolent offenses, lower level property crimes, and those people are being released with a penny bail. Now, I don't think our community understands that, because as you ask me about crime trends, guess what's going up? Commercial burglary, auto theft, and auto burglary. And we're finding that a lot of these suspects who are arrested for these crimes are just being released, and they're going back out and recommitting these offenses. And that's not good for any of us. So obviously we're going to try and do the best job possible to track those individuals the best we can. But for example, with commercial burglaries, which means somebody's breaking into some sort of a business, usually during the graveyard hours, we're trying to do things on the front end, like having our division commanders have virtual community meetings with the business owners, so that we try to impact that crime. But as we're talking about crime and we talk about the 1 cent bail, you're right. The sheriff's department, according to my numbers, have released over 9,000 prisoners in the last month. So what I'd like to ask our community to really pay attention to is, if you have thousands of prisoners being released into LA County, and we're trying to get the numbers of how many of them are in Long Beach. We have estimates of how many of those are probably coming back to Long Beach, but believe it or not, people aren't honest about their addresses and aren't always very forthcoming about it. So we're not exactly sure. you couple that with the fact that you've got kids that are out of school. They should be at home doing schoolwork. I get that. And then you layer on top of that the unemployment rate that we're potentially looking at. And in all the years I've been in law enforcement, you start mixing that together, and that typically is not a good mixture for us. So we at the police department are very concerned about all these dynamics, and we're watching it very closely. But let me throw out one more thing, because I'm giving you a lot of information. You asked me about crime in Long Beach. As of the end of March, and as you know, Jeremiah, we track our 3010, and it's about a month behind. So our crime stats at the end of March for Part 1 crime, overall crime in the city of Long Beach is down by 4%. So it's negative 4%. And but it's some of these areas that I'm concerned about that we're starting to see an increase, and I'm hoping that we and it's not just us in the police department, but our community, that we're doing some very important things. And I'll stop talking there for a second to let you jump in, because again, there's a lot of information to put out.
No, that's okay. You actually answered that question I had, was with all these factors, does that mean crime is going up? But it sounds like it's gone down, but you're anticipating, well, I guess you don't know what's going to happen next with all these factors swirling.
Yeah, it's down right now because we as a city have been doing great. But then you have these unforeseen circumstances with unemployment, the pandemic, and everything else mixed in, all these prisoners being let out. And again, I haven't heard anyone talk about this, putting it all together, and what does it mean for our city? So we at the police department are on our toes. We are going to, in the middle of this pandemic, we still have a job to do. And we're out there. Our police officers are out there every day. We're still responding to crime. We're still investigating crime. But at the same time, we're helping our brothers and sisters at the rest of the city manage this pandemic through the Emergency Operations Center.
Let me shift a little bit to what that means for frontline officers, patrol officers, detectives actually interacting with the public out there doing the work, making arrests, writing citations. First off, how many employees have you had test positive, and then how many have been quarantined or isolated and monitored themselves for symptoms?
So according to my latest figures, and these are as of last night, we've had 26 employees tested, and a total of 3 have come back positive. 2 frontline police officers and 1 of our civilian police employees.
And what I've been told is that was a patrol officer, a detective in the investigations unit, and then, like you said, like a clerical or secretary type employee. Is that right?
The first one that tested positive was a patrol officer. And then the second person who tested positive was our civilian staff member. And then the third was a detective assigned to our special enforcement division.
And do you know how they were infected? Was this something that was spread through the department, or maybe they came in contact with somebody in the public? I know that's probably a difficult question, something the health department's investigating, but do you know at this point?
Yeah, with the first one, I don't know if we were ever 100% sure. The health department is still looking at that one. With the last 2, the health department is still investigating those. Now, some employees may assume, hey, I got it here, I got it there. And sometimes, even for us, we want to be able to say that's where he or she got it from. But until the health department tells me, I'm not even going to take a guess, because the level of anxiety that we create is just off the charts.
Yeah, I think that anxiety is a good point. I mean, there was even an officer who went public, I think last week, worried about the gear officers were being issued. I think she was specifically concerned because she felt like officers were being discouraged from wearing their protective gear at some point. So I think you addressed that earlier. But I've heard from other officers too that it's difficult to know when to put this on, when to use this, especially when they're responding to snap situations. And specifically, a couple people have told me that they felt like the instruction was a little unclear at the beginning of when to put on the N95s, their goggles, and the protective gowns they've issued. And I'm curious, what exactly are our officers being told about when to put this protective gear on?
So I've got, and I stated earlier, 1,400 employees, and I love every single one of them. And I want to make sure that every employee feels like they are protected and that we're doing everything to make sure their health and welfare is our top priority. And I get it. People are going to come out, and just like in any other organization, you do have individuals that'll come out and say, hey, this isn't being done. When we looked back on it, at the end of the day, I'll look to anybody and say, if there's miscommunication, it falls on me and me only. So I have to go back and make sure that I follow the track of how we communicated to each employee on this police department when they could don their equipment. So we have sent out several documents, whether they're watch reports. Assistant Chief Wally Hebish has a daily email that goes out where he has spelled out what we're doing, why we're doing it. So if employees and supervisors are reading that, they should know exactly when and when not to don it. At the end of the day, it is very difficult to be a police officer and maintain that 6 foot physical distancing between people at times. Although we try to get people to exercise it, but it's impossible. You're still got to do police work. So I believe that we have given everybody the proper equipment. There may have been miscommunication about when and when not to use it. But in the last week and a half, 2 weeks, we have clarified when you should don that equipment. But I also have to say, about a week and a half ago, we've got a large donation of N95 masks from UPS, and that was delivered for both Long Beach Police and Long Beach Fire. We have equipment here, and I think what happens, like in any organization, you're trying to manage the equipment, and you're trying to make sure that it's used appropriately. And when it's used, all we're asking is that you tell us so we could replace it. And I think people sometimes get angry because they just want to be able to use it whenever they want. And I'm responsible for managing all the equipment that we have. And when you look at the news every day and you see doctors and nurses and other frontline workers that are complaining that there's not enough PPEs, I get it. There's a level of frustration across the country. But I am very proud of our police department and the way we have issued equipment, the way our officers are able to use it. And all I'm trying to do now is improve the communication lines between myself, the command staff, and our frontline officers. And you and I started to talk about some of these meetings that the assistant chief and I are having with our employees, because we want to hear from our frontline employees. And already we're getting some really good feedback, and we're responding to some of the complaints. And it's 99% of it is miscommunication. And
for us,
it's on me.
For those of us who aren't privy to that communication, what actually is the standard for when officers should use this? What's the communication that's being given to them to say, here's when you put it on, here's when you don't?
Typically, the way this started out, it was through watch reports. We put out a document that is supposed to be read at each roll call by the front level supervisors, and that explains to the officers when they can use it. And there's circumstances there that basically, if you're on an incident where you believe that somebody may be infected, that you obviously don the PPE. Anytime that you feel that you can't maintain that 6 foot distance between somebody, you can absolutely break out that N95 mask. And we made sure that that is very clear now. It appears that may not have been as clear as we would have liked it to have been in the beginning. So I believe we've corrected that. but AC Hebish and I have several meetings we're going to be attending in the next week with supervisors to make sure they hear directly from us, not on video, not over paper, but actually, again, practicing social distancing, get as many people as we possibly can, which I think the limit is 8 to 10, and separate everybody with our mask.
I wonder if some of the frustration is just the difficulty of a frontline officer responding to a quick situation. Where I've had some tell me they're worried about putting on that protective gown because they're worried they won't be able to easily access their gun if they put that on over their gun belt, or they're worried it's covering up their body camera. And I wonder if there's anything that can be done about that. Is that just a damned if you do, damned if you don't situation? Some of them have brought up changing their uniforms entirely to try to make things easier and more sanitary. Is there a solution to that?
I have not heard any complaints about donning PPEs and the gun part of it or the body worn camera. If I start hearing that from our officers, obviously we'll look for a solution. In regards to, I'm sorry, the second part of your question was?
I guess it was the changing uniforms. I know some of them have asked about the wool uniforms, I guess, in patrol are dry clean only, and sometimes they have to rewear them. They're worried about being sanitary. And I know everybody's trying to take precautions to protect their family from being infected. And I wonder, I know that's been brought up to change to some kind of uniform that's easier to wash and wear.
Yes, and that's a very legitimate concern. So legitimate that what we did as a department, as a city, is we are now paying for dry cleaning for frontline officers. If you're out in patrol or you're working a detective function with a wool uniform, is that the city will now pay, and you want to change out that uniform every day. We have instituted a process where you can do that now. In regards to a longer term solution to change into some type of uniform, we've actually been discussing that through our uniform committee now for months. And it actually started not because of this pandemic, but you see a lot of police departments around the country that have this outer vest that is a lot more comfortable. And realistically, when you look at a lot of our workers' comp claims, they are for lower back injuries. So if we could figure out a way to redistribute weight of an officer, that would be very helpful to us. So that is something that has been in the making for a while. Obviously, this whole thing slowed things down, and that's still on the table. But I think some officers want us to change like next week, next month, and I get it. So that's why in the interim, we're going to do the uniform cleaning for them. We as a city will pay for that because we understand the concern. And then regards to the PPEs, please remember this, that eventually I think somebody's going to come up with a PPE that's made for law enforcement only that will deal with the body worn camera and the gun. But this hit us, and I think the adjustments that our team made to get PPEs in the hands of officers within days of this first breaking out was amazing. And I know we're asking questions about individual officers' complaints, but I really want to tip my hat to the officers, and there were police officers who were in charge of our incident management team that worked their butts off. Jeremiah, these guys and girls weren't taking any time off. They were working 16, 18-hour days to try and equip our officers, to put officers in the best position possible to be safe, healthy, and succeed. And it does get frustrating after a while because you will hear complaints. You always do. But it's not on the officers who work so hard to get us to where we're at today. It was more of a communication issue, as you've identified. And our executive team is working to make some of those corrections.
I think you hit on a good point there, that this came on so quickly, and it seems like part of the problem is you don't know how long it's going to last. Like nobody really knows what the end date is. And I just wonder what that looks like for you from this position. How do you look at this long term about how you get back to normal, if you ever do get back to normal? And then you have to worry about the economic impact of everything too.
Yeah, you're right on. And as we meet on a daily basis, either on a conference call with other city department directors, which we call our agency administrators meeting. And then we're meeting every day here in the police department. And we're not only talking about COVID-19 related challenges, but everyday business. You talked a lot about crime and other things that are facing us. But we don't have an end date. I think everybody's that part of that anxiety and fear. You want one of the leaders in the city or the state or even the country to say, okay, on this date, we're done. I'm sorry. I would love to hear a date too, but the facts, the science, I should say the medical facts don't support that. And I think we have to be very cautious. I get it. I'm really nervous about the economy as well. But I think people's health has to come first. And that is very critical. So we are in it for the long haul. I don't know. Some people estimate this may be over by the beginning of summer. I'm hearing now that, even if it does, we have to be ready for this to hit again in the fall or the winter. I can tell you this, that we as a city, we're prepared for just about anything and everything. And even though we used to say we were ready for a pandemic, I think we're doing pretty good, but we've learned a lot of lessons. And if this is true, that this is going to hit again in the winter, we as an organization are going to be so much more prepared and learn a lot of lessons, PPEs, health orders, whatever it may be. We're going to nail this. And again, I can't say enough about where our city is. And not only the employees working for this city, but the community. I think I'd compare us to any large city in the United States, and I'd say we were in the top 10.
Chief, I know we've gone a little over, so I want to just say thank you for your time. And I didn't know if there was anything you wanted to close on, any message you wanted to leave this on, or any story you wanted to share about the work your department's done. I know we covered a lot of ground, so thank you for taking all those questions.
Yeah, I appreciate that. And as we are wrapping up, I heard somebody famous once say, and it's a quote I'm stealing from somebody, but it's years ago, and it said, let's allow the worst to bring out the best in us. And that's a message to everyone in the city that whether this is subsiding or maybe it gets worse, I hope it doesn't get worse. But even if it does, we really have to support each other. We have to make sure that we're not passing on misinformation, that we are helping our neighbors who are in need. And there's so many great stories. And I don't know how much time I have, Jeremiah, but
as much as you want, go for it.
The first weekend that this hit us pretty hard, and I could be wrong on the date, but I want to say it was March 7th. That was the weekend where we had a Carnival cruise line that was slated to, I think they had just come back into Long Beach, and there was somebody that was on there was sick, so they didn't allow people to get off the ship. And then there were thousands of other people who were coming into the city to board for the next ship that was supposed to go out. And the teamwork between Carnival Cruise, our incident management team that consisted of health, police, and fire, and some other city departments, the planning, the coordination, when they got a hold of our business community and they said, hey, we need help. And the business community turned around and talked about hotels. They brought in food trucks. And as bad of an experience as that could have turned into, people were patient, they behaved, they were well treated. And at the end of the day, I don't know if that story got as much attention because it went so well, but there was so much work, so much commitment on some passionate people who just cared about other people and made it work. And I think that set the tone for us here in the city, that our city was going to take this on and handle it the right way and move forward. And I got to tell you, I will always remember that story. I have a lot of stories after working here 34 years, and that's going to be at the top of my list. And we hear individual stories every day of either people in their 80s having birthday parties. Let me take that back, having birthdays, and maybe a caravan of cars going by to pay tribute to them, or a child that has cancer whose birthday it is, and you see fire trucks and police cars. Our employees, our police officers, are really stepping up to the plate, doing a lot of amazing things that aren't on social media all the time, that aren't being told, but we hear about it every day. And I can't thank our employees enough for what they're doing on a daily basis here for our city.
Chief, thank you for coming on and taking the time to share some of those stories with us. And hopefully we'll have you back one day. This thing is not going away anytime soon, it seems like, unfortunately, but it's good to have you talk through some of the things your department is doing. I appreciate it. Thank you.
Oh, thank you. And please know that we have an awesome city team. And no matter what direction this goes, you have great people that are committed, and they're going to get our city through it. So please know that.
And thanks everybody for watching. Tomorrow we're going to have at 1 p.m. we're going to have Jill Baker, who is becoming the next superintendent for the Long Beach Unified School District. Thanks for watching.